Sanovas Surgical Technologies is excited to introduce its revolutionary smart catheter technology, the Voss Zeppelin. Sanovas technology significantly advances minimally invasive surgery through advanced visualization and physiologic measurement systems that operate within new sensory-guided interventional catheters to provide advanced diagnostics, navigation, treatment, resection, and the point-specific delivery of drug and immune therapies, creating innovative new solutions that are poised to become the standard of care in the interventional pulmonary science. This animation presents an overview of the Sanovas Voss Zeppelin technologies. A biopsy of the tumor tissue can be obtained by deploying a steerable imaging catheter through the bronchoscope as it approaches the tumor. The steerable imaging catheter has a central cannulation that allows a microbiopsy capsule to pass and advance toward the tumor. Once at the target site, the biopsy capsule is linearly actuated to recover and protect the biopsy specimen, which is subsequently removed for examination. Next, an anchored guide wire is advanced toward the tumor. In the event that the obstruction completely blocks the airway, a laser fiber or RF probe is used to core out a route through the lesion. The laser or probe is placed through the central cannulation of the guide wire. The balloon at the distal tip of the guide wire is inflated to the absolute diameter of the native airway or vessel so as to perfectly center the laser or probe. The laser fiber is actuated by contact and advanced through the lesion. The recannulation creates a core through the lesion with a diameter sufficient to match the deflated anchoring guide wire and thus navigate it into place. The laser or RF probe used to core through the lesion is withdrawn and replaced with an imaging fiber. With direct visualization, the guide wire is advanced through and past the obstruction. The balloon anchor is deployed to approximately 120% of the modulus of the airway walls, sufficient to purchase the walls of the airway circumferentially. Depending on the location of the pathology and the interventional requirements, the appropriately sized Voss Zeppelin is selected and navigated into position. The various devices enable a distal blockade of the airway to prevent the inhalation of blood and cellular debris, as well as an airway bypass to maintain the vitality of the lung, allowing the patient to breathe throughout the procedure. The Voss Zeppelin is connected to the PhysioSense control station, an intelligent device that collects physiologic metrics and biologic analytics to further assist the surgeon obtain an improved spatial awareness and intuitive command of the operative environment. The PhysioSense is an intelligent sensory device that allows the surgeon to measure multiple aspects of the targeted anatomy and to adjust, control, and display various other functions of the anatomy and of their operative devices, such as direct and three-dimensional imaging, balloon controls, energy sources, tissue resection, and drug delivery. Operatively, as the Voss Zeppelin is advanced toward the pathology, a diameter measurement of the native geometric lumen area is obtained. The modulus of elasticity of the airway wall is also obtained. The Voss Zeppelin is then advanced into the pathology, wherein these measurements are further obtained, as is the density of the obstruction. Next, the Voss Zeppelin is advanced distal to the pathology, where diameter and modulus measurements are again obtained. These measurements are indexed in the PhysioSense, wherein they contribute to an algorithm that controls Sanovas' proprietary non-thermal recannulation method known as pulsection. These measurements are continually obtained throughout treatment intervention and are used to further generate a 3D replication of the anatomy on the PhysioSense monitor. With the appropriately selected and sized Voss Zeppelin construct in place, the obstruction is removed organically via sanovas proprietary pulsection method. The indexed measurements obtained on approach are continuously recalibrated and monitored to adjust the algorithm that controls the resection of the obstruction in a manner that expedites both treatment and recovery by respecting the anatomy, controlling bleeding, and preventing tissue destruction and the vaporous discharge often created by thermal methods of resection that can lead to revision procedures, embolism, stroke, or death. Once the airway is open, the Voss Zeppelin is redeployed into place, creating a chamber through which drugs, biologic agents, and/or immune therapies can be delivered to the tumor that remains beyond the airway, an area termed the submucosal or submural space. A drug delivery probe is also available when specific targeting is necessary. When deploying drugs and immune therapies within the chamber created by the Voss Zeppelin, they are energized into the tumor via sanovas proprietary extravasated drug delivery method. Effectively, the agents within the chamber are pressurized, creating an osmotic effect that impregnates the tumor. These agents are intended to kill the tumor independently or in combination with radiation therapy. When focal delivery is required, an appropriately sized pressure vacuum actuated drug delivery probe is navigated into position and deployed, releasing the agent into the tumor. Radiomarkers may also be injected with the agents, enabling indirect visualization to discern the appropriate depth of penetration to the margin of the tumor. In addition to drug and immune therapies, there are additional methods often deployed to treat the various pathologies found in the lungs. Sanovas' platform of technologies are enabled to deliver solutions such as photodynamic therapy, thermal energies such as laser and radiofrequency, and cryogenic desiccation. It is well known that lung tumors are therapy resistant due to their hypoxic nature. Hypoxia is a condition of tumor pathophysiology wherein the tumor lacks oxygen at the molecular level. This is consequential because radiation therapy requires oxygen at the molecular level within the first millisecond that it is delivered. Oxygen is what facilitates the transport of the electron beam to the nucleus of the cell, enabling the destruction of DNA, thus killing the cell. Sanovas' proprietary drug delivery method facilitates the delivery of oxygen and hemoglobin-based oxygen carriers to the cell, effectively sensitizing them to radiation. The lungs have long been recognized as the last frontier in the interventional science due to the need to keep the patient breathing and due to the lack of technological advance in the miniaturization of interventional tools and techniques. Sanovas is proud of the contribution it is making to advance airway intervention on behalf of the interventional pulmonary science. Sanovas breathing innovations now enable patients that have historically been palliatively medicated the ability to breathe better than ever.